I'm Dr. Ben Samuels, an associate professor in the Behavioral and Systems Neuroscience area of the Department of Psychology here at Rutgers, New Brunswick. Major depressive disorder is a huge burden on society. Depression affects approximately 350 million people globally. Depression shows a comorbidity of 50 to 60% with anxiety disorders. What that means is there's so much overlap between depression and anxiety that you're just as likely to be diagnosed with both disorders rather than just one. Something that's important for the way we think about depression in terms of using rodents in our research program is that depression can be precipitated by stressful life events or chronic exposure to stressful experiences. And something else that's kind of a challenge for thinking about how to use rodents in order to study depression is that in humans, depressive disorder is diagnosed based on self-report. So patients will meet with their psychiatrist or doctor, and they may be probed by some sort of questionnaire. But the diagnosis of depression will be based on the patient explaining what symptoms they are having. The challenge in using, in our case, mice in order to study mood disorders such as depression that occur in humans is that mice can't self-report their symptoms. They can't tell us how they're feeling. We can't give them a questionnaire to ask them, what symptoms they're having that are related to a human mood disorder. And we want to be careful not to anthropomorphize the mice either, to assign human qualities to mice. So the way we've approached this is to really think about what types of behaviors can we observe in mice that we could potentially observe very similar behaviors in humans, for example, that are studying from mood disorders such as depression. We've helped develop mouse effort-related choice, which is an assessment of motivation. And there's a very similar version of this task that exists for humans that's run on a computer. So in effort-related choice, a mouse is released from the start area and must traverse a Y-shaped maze where it has been trained that one arm, in this case the left, contains more food or water. We then introduce an obstacle, such as a 15-centimeter high barrier, so that the mouse must now exert effort and climb over the barrier to get to this higher value food reward. Mice that are exposed to chronic stressful experiences are less likely to climb the barrier and will instead go for the arm with less food reward. That's very similar to humans suffering from depression, who are less likely to exert effort for high value rewards in the computerized version of this behavioral task.